Now let's talk about the various issues surrounding the COVID-19 pandemic. I have joining me a public health physician, Ugonaya Igwilu. Good to have you join us, Dr. Ugonaya Igwilu. Now, there are several issues. There are several issues arising from the COVID-19 pandemic, whether it's the economy, is how people are not responding to protocols, or just even the origins of the virus, which is a conspiracy theory. In all of this, what is a concern for healthcare workers? What is a major concern for healthcare workers?
Thank you very much. So basically, our concern is when we're having the public believing in these conspiracy theories, it puts, first of all, health workers at risk, it puts their loved ones at risk, and it overwhelms the health system. Remember that our health system is not as robust as we have in other climes. So it's very important. That's why we keep emphasizing the importance of trying to address fake news, conspiracy theories, and keep emphasizing that this COVID-19 is actually very real. And you're having a lot of people losing their loved ones daily. You're even having health workers come down with it, and some of them we've lost them in the course of this pandemic. So it's very important that we want the public to really take this seriously, because we don't have that capacity. We don't have enough health workers to even, to be able to handle this. So that's why we're trying our best by carrying out, ensuring that these public health measures are adhered to, and we're constantly engaging the community so that they even listen and, adhere to the necessary precautionary measures.
But are we addressing it? Because there are people who do not believe that the virus exists. That's on the one hand. There are those who believe that it exists, but it is man-made. So there are just different conspiracy theories within this pandemic, making it very difficult to curb. Are we really addressing it, especially in Nigeria?
Okay, so definitely, I know Nigeria, we're doing our best, because I can't completely say, oh, we're not doing anything. Because, for example, NCDC has come out to address some misinformation that has been, going on, little things are. But remember that the thing about these barrage of information is that they're coming from different angles. So what we do is that we try as much as possible, as health workers, people in the health system generally, to try to combat this misinformation. But of course, you always have those who would still not believe it. And it's not just peculiar to Nigeria, all over the world. You always have those who would still be in denial of this COVID-19. So what we do is that we try to do things like documentaries, which I think, I know BBC did one. I don't know if it was TVC, or I think there was also another more recent documentary that happened in IDH. So it's things like that actually help. People get to see what is going on inside these facilities, that people are actually going through a lot. And, survivors get interviewed, people who have even lost loved ones come out. And, of course, we see prominent members of the government come out and say, oh, they've come down, they've contracted the virus, they go in and they come out. So people see this. So when people get to see, they get to know that, oh, this is actually real and it's happening. Definitely, we're doing our best to fight it. But most times, the resources to even fight them, sometimes it's not even sufficient enough, but we do the best that we can to address the misinformation.
So TVC has continued to visit these isolation centers. So the documentary you talked about was actually done by TVC. We've continued to visit isolation centers, especially for people who say, look, we do not see some of those who have, or the people who have this virus. But let's also now look at the number of deaths that we're recording. We're seeing, it is really high recently, 12 fatalities a day, 8 fatalities a day. Sometimes we've gone for several weeks without fatalities. So what exactly is going on?
Okay, so like we said, of recent, what happened was that we had a second wave. So, with the opening of things like, the airports that occurred around September, they're now coming down, to December, when we had a lot of social events, which of course were classic super spreader events. That now caused that spike. Now add the fact of that new strain. The new strain actually causes a higher rate of transmission. So that's why you now see within short periods of time, you're seeing these increased spikes. You're seeing more people coming down with it. And of course, which means that those who are at risk of dying and coming down with the severe forms of this disease now gets to contract it, because we had a lot of people traveling and moving around. So yes, it's definitely an issue. And definitely, like, I'm really happy that TVC did that documentary, because it was very helpful, because I watched it and I was so glad that that was done. And I know that over time, I'm seeing more Nigerians even coming around now to actually believe that, no, COVID-19 is real. When they see this happen, when they see things like this, it actually helps. Of course, it cannot be done within a day or within a week or within a month, but it's a process, and we're hoping at least we get there sooner, at least as fast as we can, because want to make sure. And remember that there are some deaths that have occurred that we could not even confirm that it may have been from COVID-19.
All right.
Virus. So
just allow me to quickly jump in, because I know that you are making a very critical point, but I just want to quickly jump in because there is the latest development, and we're hearing from the NCDC that now we're running out of hospital beds. There are people who have the virus, they go to the isolation centers or the hospitals, but there are even no beds. I mean, how critical is this, and what is the implication of this?
It's very, very critical. Remember that, first of all, it's not just about having those spaces. You need health workers to man those spaces. And of course, with the first wave that happened, you had a lot of health workers, being overwhelmed. Of course, some of them were complaining about not being paid, or getting the insurance or those necessary things that they needed. But yes, we still had some coming back. But remember that at the end of the day, what is the proportion of what proportion of Nigerians do we have? What's our population? 200 million. How many workers do we have per person? So definitely we're going to be overwhelmed. So we might even create more spaces. We can even convert all the stadiums in Nigeria to isolation centers. But remember that you need health workers to care for them. So, that's the important thing of trying to, encourage them, encourage the health workers, try to train more people, because at the end of the day, this is what happened in other clients that are even more developed than ours. And that is still happening. A lot of them are getting overwhelmed. So the best we can do is just hope that, we get more people to buy, we get more, more resources to come in to, and also get more health workers and, get them motivated to even, come in and work in these centers.
Public health physician, Dr. Ugonaya Igwilu, thank you so much for talking to us.
Thank you for having me.